So stem cell therapy has been out for years, but we're constantly, looking at the science, and we're learning new things about stem cells and their uses, and how do we direct them in your body? How do we make them thrive in your body? How do we make them adapt to your body? This specific procedure I think has been around for several years. The doctor that I trained with, he's done several publications on the outcomes of these results. And I'm actually fortunate. I'm one of about 5 doctors in the US using this technology right now.
Hello, my friends, and welcome back to yet another episode of I Love Being Sober. My name is Tim Westbrook, and I'm the CEO and founder of Camelback Recovery here in the always sunny and always sober Scottsdale, Arizona, where my team and I, over the course of many years, have helped thousands of people on their path to recovery. We started this show because there's so much misinformation about addiction treatment, mental illness, and recovery in general. There's so much more to recovery than just going to inpatient treatment, seeing a therapist, and going to 12-step meetings. All of those things are important, and AA saved my life. However, to find long-term recovery and live a kick-ass sober life, there's a lot more to it than just stopping the drinking, stopping the drugs, stopping the sex addiction, or stopping any addictive behavior for that matter. To live a new life, a person needs new, healthy lifestyle habits. Typically, this includes new eating habits, new sleeping habits, new exercise habits, new hobbies, new interests, new friends. Self-care becomes a priority, and the list goes on. Those are just some of the types of things that we talk about here on the show. And today, I'm here with Dr. Nicole Srednicki. Dr. Srednicki is a doctorally prepared, board-certified family nurse practitioner who graduated from the prestigious Georgetown University Magna Cum Laude in Washington, D.C. She's also the founder of Ultra Healthy Human in Scottsdale, Arizona. She's a primary care provider and is also board-certified from the American Academy of Anti-Aging and Regenerative Medicine. She has also completed a fellowship from the Metabolic Medical Institute and had additional fellowship training in anti-aging and natural medicine. Dr. Srednicki enjoys using her education and training in aesthetic medicine to make her clients feel as beautiful externally as they do internally. When Dr. Srednicki is not traveling across state and country lines to see some of her patients, her passion is facilitating wellness retreats in which clients stay on site at her beautiful oasis in Scottsdale, Arizona, which focuses on internal and external health and beauty transformation. She successfully combines conventional and complementary medicine seamlessly in her practice, while utilizing cutting-edge, science-driven regenerative medical therapies and techniques. Today, we are going to talk about high-performance health, the 21-day detox, which I just completed successfully, the impact of stress and ongoing health versus an annual physical. So, Dr. Srednicki, welcome to the show. I'm so happy to have you here.
Thank you so much, Tim. Thank you for that wonderful introduction, and thank you so much for having me on the show.
Absolutely. Absolutely. Okay. Well, I'm excited to learn more. I know you. I see you. I've gone through the 21-day detox, and so I trust you. And yeah, I'm looking forward to this, and I'm looking forward to sharing some more information with the world. So first to start, so your title is, let's see here, Dr. Nicole Srednicki, DNP, ABAAHP. So to start, what is a DNP?
So that means doctorally prepared nurse practitioner. So depending what state you live in, that kind of determines the extent of your licensing and what you can do with patients. So we're really lucky here in Arizona. I'm completely autonomous, meaning I don't need a physician over me. I have full diagnostic and prescriptive authority, which is awesome because, we'll get into the details, but, I wanted to start my own practice because I wanted to carry out my mission.
All right, there you go. What is an ABAAHP?
So this is the American Board of Anti-Aging Health Practitioners. So that's one of the additional board certifications that I went through and fellowship training in order to become very cutting edge in what I'm doing and not just, like regular doctor visit.
Okay. And what gives you the right to claim you are an expert on high performance health?
So my approach is using very personalized medicine. So, I don't want to treat you like a statistic. So when I look at you as an individual, your blood work, your lifestyle, your genetics are completely different from everyone else. And so in order to make you a high performer, we need to really look at every detail of you. But also, in high performance health, you can't just be writing prescriptions. Okay. You need to be doing things from different healthcare approaches, having a whole different elements of health in your life. So not just going to the doctor, but you're using cutting edge medicine in your life or therapies. You are, getting massages. You're going to acupuncture. You might be doing cold plunge. I know that's one of the things you advocate, which is really awesome. Really having a very good program that's individualized to you and you're seeing results.
Okay. So when you say cutting edge modalities or cutting edge interventions, what are you referring to?
So one of the things that basically my favorite thing to do in my practice, one of my favorite things, I'm using a very cutting edge procedure called V-cell procedure. And basically what this is like we are able to activate micro stem cells that are in your body, and we're able to with a specialized laser, direct them into your body, into different areas. So it could be an injured knee. It could be aesthetically, I want my skin to look better. Or it could be just overall rejuvenation. There's a lot of different indications, but then basically what it does is go to these areas and rejuvenates these areas like when you were a child. So when you think about like when you were 5 years old, if you fall and break your arm, or right now, if you fall and break your arm, who's going to heal faster? 5-year-old, right?
5-year-old, yeah.
Okay, and that's because they have such an abundance of these vibrant stem cells and different specialized types of stem cells that they're able to heal so much faster. They have all of this cell turnover that keeps them young and healing fast. And that's basically what this procedure does. It helps to rejuvenate your cells and bring them back to that youthful state so that you can slow the aging process or potentially reverse it.
Okay, so now are you injecting stem cells?
Yes. So with this procedure, there's different types of stem cell procedures you can do. But with this, we actually pull these stem cells out of your blood. We separate them, and then we use this laser to activate them. We re-inject them into your body, either through an IV or directly into a joint, into your face, directly into an organ. And then we use the laser to direct them. One of the things with stem cells is they are attracted to areas of inflammation. So traditionally, a lot of the stem cells on the market, when they get re-injected into your body, they aren't directed anywhere. So then the cells don't really know where to go. So they just go to different areas in your body, different, areas of inflammation, not necessarily that area that we want to get to. So that's where this laser adds that additional element. And this specific type of what I call the V cell, very small embryonic-like stem cell, or in short, I call it a micro stem cell. Mm-hmm. These are typically dormant in your body, except during emergency situations, like you're having a heart attack or you're giving birth. And other than that, they're dormant. So we have actually figured out a way to take them out of hibernation and put them to use.
Okay, now how new is this technology?
So stem cell therapy has been out for years, but we're constantly, looking at the science, and we're learning new things about stem cells and their uses, and how do we direct them in your body? How do we make them thrive in your body? How do we make them adapt to your body? This specific procedure I think has been around for several years. The doctor that I trained with, he's done several publications on the outcomes of these results. And I'm actually fortunate. I'm one of about 5 doctors in the US using this technology right now.
Okay. Now, I had a shoulder or rotator cuff surgery back in, I think it was probably 2013 or 14, and they injected stem cells, and the doctor said that I was the fastest recovery he had ever seen with my shoulder. So, and that's kind of why I was asking how long it's been out for. And I'm wondering if I don't think it was the same thing, because he didn't take stem cells from me. They were stem cells from somewhere else or somebody else, or I'm not exactly sure where they came from.
Sure. So one of the other, you can get stem cells from amniotic fluid. You can get them from umbilical cords. You can get them from different areas in your body. So they can come from either you or somebody else. So one of the benefits of getting them from, let's say, an umbilical cord is they're so young, there's so much there, versus if you take them certain types from your own body, you're also exposed to, those cells are exposed to that environment a lot longer versus a newborn. However, we have found differences with these V cells versus the traditional stem cell treatments where they're pulling stem cells from your fat or from your bone marrow.
Okay. Yeah. And I guess that's kind of where I was going is is it more effective to use my own stem cells, or is it better to take stem cells from a young,
a newborn.
Yeah. Exactly.
So that's a very good question. So it does depend on the individual. So for example, I have a young athlete right now. He's in his 20s. He busted up his knee, and now we need to get him back on the basketball court as fast as possible. So we're doing stem cells from his own body are perfect because he's still at that young age. Yeah. Great cells. Ideally taking cells from our own body is best for our environment. We're able to accept them back into our body much, much easier than using umbilical cord stem cells. Now we will accept them. It's not like getting a blood transfusion where we have to match. When you get cells from umbilical cords, they are so basically naive that they can adapt to your body. But going back to cells from our own body, V cells are different from stem cells from your bone marrow or your fat. I'm not a fan of pulling stem cells from your bone or your fat, no matter how old you are, even when you're young, because of that environment. Sometimes if you're really, really young, it's okay. What I have found, because I've used it all, I've been using stem cells for years and some of the different biologics. This V cell procedure, I have definitely by far had the best outcomes. And that's where you are getting it from your own body, but you're pulling them from the blood. Okay.
Now, V cell, what does V stand for?
Very. So very small embryonic stem cells. So VSEL. So in short, I just call them micro stem cells. One of the other benefits to this specific type of cell is that it is so small that it makes it easier to direct it around the body. So we're talking about microns here. So super, super small. But when we compare if you read about stem cells, you'll probably hear the word mesenchymal stem cell a lot. A lot of doctors like to say, I use mesenchymal stem cells. So they are a larger micron than a B cell. One of the problems with this is if they are putting it into your blood, your blood circulates through your whole system. We have teeny vessels that these cells have to get through. And in our lungs, we have this micro circulation, and these mesenchymal stem cells are big enough that a lot of times they get stuck there. So let's say you're having kidney issues or something, and the doctor is trying to get these stem cells to that area. Well, often these mesenchymal stem cells will get stuck in the circulation in your lungs. That doesn't mean you're going to get a blood clot or something. It just means that's kind of where they get stuck. So you'll probably have healthier lungs, but they might not get to where you need them. V cells are so small, it's easier to direct, in addition to then using that laser to direct them.
Gotcha. Now tell me about the laser that you use to direct them.
So this is a patented type of laser.
In layman's terms. Is it like a red light laser? Is it like, do you hold it? Is it like a little wand? Like, what is it?
Yes. So it does look like a wand. It is a red laser. The key to it is that I'm using a specialized lens on it. And so if you were to look inside the blood and what this laser does, typically laser light is going to be like this. It looks like a wave. Okay. And then and it's like two, and you see them like this. So what this lens does is basically deflects. So now these are going in a different direction. It causes these wavelengths to go in a different direction. And that's what makes this so powerful.
Gotcha. Okay. So now I'm going to back up a little bit. What specific incident inspired you to be so passionate about helping people transform their health in a sustainable and proactive manner?
So this started way back when I was in school. So I originally started out as a nurse. I was working in cardiac transplants. I loved it, but I was like, there's no continuity of care here. You'd see patients like back in the hospital, or, when they're discharged, it's like they're just kind of like lost, or what do I do after this? Well, in school, they don't really teach us, about a lot of the things that I now do, things like nutrition. What can you truly do to be healthy? So when I was back in school, I was like, you know what? I want to take my career to the next level. I want to do something that actually helps patients. So that's when I became a nurse practitioner. But when I was in school, I was like, all we're learning is how to get the patients in and out as fast as possible, do what the insurance says, and throw prescriptions at them. So all we were doing was taking care of illness. We weren't doing anything to make people healthy. So that's why when I got out of school, I was lucky to find out about this board that we talked about earlier of anti-aging medicine. It really taught a whole different approach to look at health. And then I went through that fellowship, and then I found an amazing pioneer physician in New York City that very well known. And I went knocking on his door and I said, I want to learn from you. Uh-huh. And so I did a fellowship in natural medicine with him. And after that, I was like, I don't fit into the traditional healthcare system, so I'm going to start my own practice. And I'm very grateful to be traditionally trained. I think there is a time and a place for traditional medicine. If you have an illness, you might, absolutely need a prescription. But what I want to do is for those people that are healthy, or that are, they aren't finding answers to a symptom they may be having, I want to help those people get back to their baseline, or become healthy, or stay healthy.
Right, which is not in line with traditional medicine, meaning that you can't necessarily, for somebody that just wants to be proactive, can you use insurance for some of the things that need to happen in order for a person to stay healthy?
So unfortunately, I look at insurance like sick insurance. Insurance doesn't recognize being healthy. Interestingly, I had a patient a few months ago. We were talking about stem cells, and she asked me, does insurance cover this? And I said no. But interestingly, her dog has pet insurance, had a torn ligament in his knee, and the pet insurance covered stem cells for her dog. So I guess insurance is ahead of the game.
Okay, that's awesome. Well, I have pet insurance for Wayne, so if he ever needs stem cells, I guess it's covered.
There you go.
Okay, so now, yeah, and I know because I've seen you, and I've had blood work done, and like in order to really have like full diagnostics done, those blood tests or those labs are not covered by insurance typically.
So some of them, like what I do in my practice is I don't take insurance for my visits, but I do pass along people's insurance to the lab where I'm doing the labs, and I go through and I try to do, the best I can to do the coding so that your insurance will cover it. So at least like for some of the blood work, we can get some, sometimes people can get some coverage. But yeah, typically it doesn't cover everything because they just want to look for disease that's already there. I'm looking at you saw, very comprehensive blood work. Yeah. I want to see, I call it your internal body mapping, where I want to see, how much inflammation is in your tissues, in your cells. What are your vitamin levels? How much heavy metal do you have in your body? Because all of this creates inflammation, which is the foundation of every disease. And it also creates accelerated aging. So when I'm looking, these are all, preventative measures or proactive versus just looking to see, do you have a prostate issue? Do you have diabetes? Do you have high cholesterol? Those basics.
What's the easiest way or the first step for a person that is not normally proactive in taking care of themselves and taking care of their health? What's the first step? What's the easiest way for a person to start down this path?
So, wow, I think I could talk about this forever.
I have my answer, but I'm not the doctor, so I want to hear what you have to say.
Well, there's super, super basics. Like, look at what you're eating. Are you exercising? How much stress do you have in your life? What are you doing for, as you mentioned earlier, self-care? Or if you're ready to take that step, find a practitioner, somebody like myself that's really looking at how do we keep you healthy or make you healthy. One of the very first things that I do with my patients is put them through a detox program. I think that no matter how healthy you think you are, we are exposed to toxins and other things that we just need to reset our body every so often. And everybody benefits from doing a detox, a high quality detox in one way or another.
Right. My answer would have been you start with a blood test, because you don't even know where your levels are if you don't do it. And I agree with you on eating healthy, exercising. But even if you're eating healthy and exercising and getting enough sleep and taking care of yourself and meditating and doing all those things, you still, if you don't have if you don't do a comprehensive blood test, you still don't know where your levels are.
I absolutely agree with that. I think I was looking at it from the approach of, like, if somebody doesn't have a lot of money to spend, if they don't have that investment to make in their blood and coming to see the doctor, at least doing something minimal can kind of get you on that path. Obviously, You're supposed to, it's not right for every single person. If you already have disease going on, you might need to be modified, but, as something basic. But absolutely, if it's something that's within their budget, which I do think everybody, you budget for vacation, you budget for retirement. You need a budget for your health too. It is an investment to stay healthy.
Right. I agree with that. It is definitely an investment. And I would also just, speaking to, I know for me, if I eat healthy, I want to exercise. If I exercise, I want to eat healthy, and then I want to get enough sleep. And then all of those things feed off of each other. So if you start down the path and you start on one thing, then it leads to another thing. If you're smoking and you're drinking and you're eating bonbons and Cheetos, then all of those things, you don't feel like taking care of yourself, in my opinion, anyways. Okay. Yeah. So you started mentioning the 21-day detox. So let's talk about the 21-day detox. What is it?
So this is a program that I formulated. I worked with a lab to actually put together all the components that go into this. And it is, shakes and supplements that what the objective is to kind of reset your body. And it helps to clean up these tissues and organs and pull out toxins that sometimes we aren't even aware of, because as over time, toxins build in our body, and it's like we might not realize it because it's not like overnight, but we might start, like having brain fog or more fatigue or having sleep issues or mood imbalance or joint pains. Sometimes this is just your body telling you, like, I'm like suffocating here. There's too much junk in my body. And this detox is designed to help clear some of this stuff out, get you on the right path so that you can now maintain that longer. The reason that it's 21 days is for something called neuroplasticity, and that's where your brain starts to create new habits. So at the end of the detox objectives is that you're going to maintain some of these new eating habits. What's really cool is, I think I mentioned it before, is like everybody benefits from it in one way or another. If it's, they have less food cravings, they've lost weight, they have more energy, they have clearer thinking, they're performing better. So many different things. One way or another, we see improvements. And even just from a personal development standpoint, making that commitment, it's not easy. And you can probably attest to this, to take 21 days of, going out to dinner and calling Dr. Nicole and asking, what can I eat here?
Yeah. Is it okay for me to have a cheat day?
On the detox?
Yeah. No, that was my question. When I went out to dinner, I was like, oh my gosh, we were at dinner and I wanted to have a cheat day. And you said no, exclamation point. So no cheat days, but it's only 21 days. So it's not that big of a deal, but you're right. I mean, 21 days feels like forever.
And so at the end, how did you feel? Were you glad you made the commitment? Absolutely. To your point, it's like mentally being able to make a commitment like that, being able to stick with it, being able to say no to, these things that I want to eat. I mean, we went out to dinner to a nice restaurant and I was, stuck eating, salad and veggies and by the way, take this off. And instead of dressing, I just want oil and vinegar. So, I mean, but it was fine. It's how you feel. And that was the thing, was getting through it and just resetting. And one of the things that I noticed, and I said this to you the other day, was that I went and had body work done probably 7 days into the detox, and my body was tight. And my massage therapist first said, okay, oh man, this is going to be tough. And he said that my muscles let go very quickly. He said within like 10 minutes in each area that he was working on, he was just like, wow, this is crazy. And so why do you think it was that my muscles and all of the kinks let go so quickly? Because the inflammation in your body was going down. And, these are some of the subtleties that we don't recognize from, what we're putting in our body. Inflammation in our body doesn't just mean my knee hurts or something like that. It's literally like making our tissues and cells inflamed. And so that starts to cause things like this, tight muscles or cellular dysfunction where it's not communicating properly. So inflammation is a huge issue that they didn't even teach us about that in school. Like that was not like in traditional medicine.
And when I think about lactic acid. It's like we're more acidic, and maybe on the 21-day detox, we're moving more to an alkaline state. Is that kind of what might be happening?
Definitely. So we're rebalancing, and to the point of lactic acid. So a lot of times, like if we're working out a lot, we get our lactic acid release. One of the other things that, like I mentioned to you, it's, sometimes hard for people who are like super motivated, but take a rest from, your intense exercise for a few days. Your body even needs a rest from that, especially going through detox, so that your body can focus on using its energy to detox versus recovering from an intense workout. Yeah.
Okay. So what are some of the main benefits of the 21-day detox? I know you've already talked about it, but if you can give me some bullet points, like three to five bullet points, what are the main benefits of the 21-day detox?
So weight loss, clearer thinking, less joint pain, better sleep, and improved hair, skin, nails.
Okay.
Much feedback on that.
Yeah. Well, and actually one thing I noticed was that my heart rate went down during the detox, meaning like my resting heart rate went down by about 10%. And then even when I was exercising, my heart rate was down as well, about 10%.
And that's awesome. I'm glad that you took note of that. That's an example of Internal stress. If you have a toxic environment that your body is working, trying to maintain, that can actually makes your body work harder to do things. So, as your body was like resetting and cleaning up, that can potentially bring down your heart rate, less stress internally.
Right. Can anybody do the 21-day detox?
Mostly anybody can. If you have severe food allergies, like true anaphylactic food allergies, you should always consult with with a doctor or somebody before doing a detox. If you have heart failure or kidney disease where, your water intake is very limited, certain medications, maybe would restrict, your salt intake or your fluid intake. But for the most part, it mostly everybody can do it, but we always have to give the disclaimer. Check with your doctor first.
Okay, awesome. And we're going to talk more about how you can learn more about the 21-day detox and how to actually do the 21-day detox here towards the end of the interview. So stick around if you want to learn more about how to get a hold of Dr. Nicole. Okay, now your doctoral studies focused on the effects of meditation on stress and mindfulness utilizing a new type of intervention. Tell me about this new type of intervention that you're referring to.
Yes. So I compared two types of meditation. So we did traditional Zen meditation, and this was a pilot study, meaning it's brand new. So I had about 10 individuals learning Zen meditation, and then 10 individuals learning my new type of meditation, which was we used noise canceling technology to basically block out any external stimuli. We don't really ever get a break from hearing. So we introduced this new intervention. We had them meditate for 2 weeks. They were all new meditators, and then we flipped and then had the Zen meditators do the new intervention and vice versa. And what we found in the end was that people had improved mindfulness and reduced stress levels in a faster time frame, and in general better, the level of mindfulness was better. And I thought this was awesome because none of us it seems like we have enough time for anything. So to be able to get into a meditative state faster, I thought was amazing. And so I had really good feedback from it. And I thought it was pretty cool because, meditating, there's no side effects and no contraindications to it. So everyone can do it.
Yeah, everybody can do it. And I know there are a lot of people that can't even imagine. It's hard to see the benefits of meditating. You meditate and you're like, okay, I don't even know what just happened. And people are so busy. To your point, everybody is so busy. They have so much going on and so many thoughts going through their mind. To take 2 minutes or 5 minutes or even 1 minute to just sit there and quiet your mind is not something that people make a priority.
Right. And it's unfortunate because it is such a healthy way to, studies have shown it can lower your blood pressure, you name it. There's, you can improve on so many things with meditation.
What kind of an impact does stress have on people both internally and externally?
So that's a really good question. It can affect you both ways. We know that stress short term can be actually beneficial. It can give you motivation. It gives you that little bit of adrenaline to get a task completed. But when it goes on for a long period of time, that's when it starts to create issues. So, the definition of stress is the body's reaction to any kind of stimulus. So you have to think about like how vulnerable we are to stress, and their tolerance for stress continues to go up. So one of the things that I, like to emphasize to people is really assess, like, don't be in denial about stress. Stress is a real thing and we all deal with it. I want you to be able to identify it so that you can get a handle on it before it starts physically affecting your body. So, I might have a patient that comes in and they're like, oh no, I don't have any stress, yet they're coming in for fatigue or anxiety or insomnia or lack of motivation. Sometimes these are signs that your body is super stressed. So, A formula or something that I like to keep in mind when I think about stress and how real and potentially detrimental it can be is stress leads to inflammation. So that's, our cells get inflamed, which leads to accelerated aging, which none of us want, which then leads to disease. So going back to the basics of stress and why it's important to be mindful of it and get it under control are huge, because stress is actually going to lead to disease.
How important is breathing to keeping your level of stress down? And I know you can walk now. I'm very aware of breathing, and I look around, and most people walk around and their breaths are very shallow and very short.
Yes. So breathing is so important. Breathing can help regulate your whole stress system. So that whole, if you've heard people talk about cortisol or fight or flight, breathing can actually help regulate that. I've done, when I'm talking to sometimes big audiences, when we're talking about health, I'll just stop and say, everybody just close your eyes and take slow, deep breaths for 1 minute, in through your nose, out through your mouth. And after, I'll ask the audience, like, how do you guys feel? And they're like, oh my gosh, like just that 1 minute, these are like little health things that we can be doing on a daily basis. Just do this a couple times throughout the day. We all can do it and can really help us become more healthy.
What is your opinion of taking supplements orally versus intravenously?
So that's another great question.
Which is more effective? Which is safer?
So I personally, when we can do things IV, I love using IV because it bypasses all of those breakdown systems that we have when we take something orally. When we take it orally, we start to have breakdown in our mouth, in our stomach, in our liver, in our kidneys. So for certain supplements, at the end of it, you absorb nothing, but your body's working to try to break it down. So our body's using energy and we aren't benefiting at all. There are other types of supplements that we definitely benefit from taking them orally. With IV, as I said, it goes directly into your bloodstream. So we can get those therapeutic doses. Obviously, if you're getting something IV, you're probably being monitored by some kind of doctor, versus just having free reign to buy all kinds of things over the counter when we don't actually know what they're doing to our body. Is that specific supplement right for you? But if we're going to compare apples to apples, I want to take B vitamins and magnesium and vitamin C. You're going to absorb more doing it through an IV. And, we're things like glutathione. Glutathione is a big liver detoxifier. And what they have found for the most part is that taking it orally, you don't end up absorbing any of it. So you have to have it IV. Not everything is available IV. So like I work with a lot of botanical medicine and, so that's like the type of thing that I usually would promote more of. Take this orally, but come in for your IV vitamins. Even for people that feel like I eat a healthy diet, why would I need IV vitamins? Well, our food isn't what it used to be. We're exposed to toxins like crazy. So, I've brought up toxins like 10 times now. And people, some people are like, well, where? Toxins are in the air that we're breathing. It's in the food we're eating. It's in your deodorant. It's in your lotion. It's in your, your perfume, your makeup. It's everywhere. And so, these are things that our body has to be able to kind of like fight back. So doing something like intravenous vitamins is going to really make your body more powerful to be able to function optimally. I think one of the negatives with IV is that you get a needle in your arm. So not everybody likes to be poked with a needle. So, that's one of the downfalls. And then just making sure that you are getting high quality vitamins. Make sure that you're not just getting a bag with, so I've heard about some of the stuff that's on the market and, it might just be a bag with not too much stuff in it. So make sure you're getting something high quality, make sure it's not filled with preservatives. I get really good feedback from people that start bringing IV vitamins into their lives. A lot of, they report, well, I used to get colds every winter. Now I don't get a cold anymore. During COVID, I had a lot of patients coming to me and like, how do we take this in that next level? How do I, how do I stay alive? I mean, I'm knock on wood. I'm so happy that none of my patients died during COVID. They're doing all of these proactive health measures and, doing some oral, some IV vitamins.
Okay, good answer. And not to mention what I've heard, I mean, the more I'm learning about supplements, over-the-counter supplements, you don't really know what you're getting. Like, unless you literally have like the certificate of authenticity or whatever it's called, you don't even know if you're getting what you're asking for or what you're paying for.
Yeah, and that's a very good point. The FDA doesn't have really a lot of oversight over what's going into supplements. So there is a lot of junk on the market. One of the things I try to do is kind of vet what types of things I'm bringing into my practice. That was one of the reasons why, I got into the development of like my whole detox program and getting into the development of supplements. I'm able to go to these labs, figure out, talk to them. Where are you sourcing this stuff? What are the concentrations? What are the levels of purity in it? So that I can feel confident when I'm making recommendations to my patients.
Okay, awesome. Okay, we need to wrap up here in a couple of minutes. So is there a question that you've always wanted to be asked, but the interviewer never got around to it? And if so, what would that question be?
I think it would be, I go in for my annual physical and I feel fine. So why do I need you? So, no matter, my answer to that is no matter how healthy you think you are, you need to know. So going back to what you were saying about the blood work. So, I've had patients that are, 75 years old come in and we do their blood work and then we figure out that their biological age, so their internal age is younger than their chronological age, versus I've had a 35-year-old that comes in and we look at their blood work and biologically they're like a 45-year-old. So we see your accelerated aging is coming fast. And kind of an analogy that I like to give is think about money in the bank, okay? So we all like to have savings, right? So if we lose our job or whatever happens, we have a reserve, right? We need this for our health too. We can't just go along blind and say, well, I went for my annual physical. They said I'm not sick. Well, that doesn't mean that you're healthy. So we want health reserves too. So we should be taking these measures so that we can stay healthy in case we do take a little step back. We have those reserves to keep us healthy.
Well, and on that note, I didn't have comprehensive blood work done for a couple of years. And when I went in December, I found that my thyroid was not functioning at 100%. And it's not that it wasn't working, but it wasn't working at 100%. And so I went on a thyroid medication. And after 90 days, and I used to need like 7 to 8 hours of sleep. And, that was my norm. And after 90 days of taking this thyroid medication, I can't even tell you how much better I feel, how much more energy I have. And I really don't need 7 to 8 hours of sleep. I really only need like 6 to 7 hours of sleep and sometimes less than 6. And I feel great, which is I never would have known if I didn't have these comprehensive diagnostics done. So it's like that. I'm all about it. I have them done every 6 months, and I'm going to always have them done every 6 months because I want to know how I'm doing, and I want to make sure that I'm ultra healthy human.
I like it.
There you go. Okay, Dr. Srednicki, how can people find you?
So they can go to my website, www.ultrahealthyhuman.com. I have the detox program on the website. So, and they can also, they can call, and if they have questions, we're happy to try to give as much information as we can. We also have an Instagram, but website or just calling us is typically the best way to get a hold.
Okay, awesome. Well, thank you so much. And hope you have a wonderful rest of your day. I appreciate you. I appreciate your time today, and we will chat soon.
Okay, thanks. Thanks so much for having me. Have a great day.
You too. Bye-bye.
Bye.